Doctor. Anything I can do for you?
Good afternoon, Carter. Tell Mason I've got those injections for his wife. I shall be at the surgery from 6 on, if she can call in.
Certainly, Doctor. Hope you have a nice, quiet Christmas.
Hope so. I need it.
Bill!
Why don't you use the steps, Nora? You'll have the whole ceiling down if you go on like that.
There, it's done. It's a bit low.
It's too low. You should leave it for Tom.
I'm getting it ready for Tom.
You're going to do the willow pattern, aren't you?
I think it's enough when I've done the pictures. I'll have to use the steps again.
When I was a girl, I could climb trees like a boy. I wasn't a bit afraid of heights.
You think we've got enough? Of course. There's lashings and lashings. You mean scratchings and scratchings? If Mummy asks us where we got it, say Dr. Collins' gardener gave it us. But he didn't. Yes, he did, only he wasn't there just when we were going to ask him. Besides, he's still got our football.
Mummy, are you hurt? No, dear. I'll be all right when I get my breath.
Keep the steps out of your mummy's way. Go and get her a glass of water. I think David ought to go and fetch his daddy.
Shall I, Mummy?
Yes, dear, but mind the buses.
Mummy, what can I do?
Oh, dear, just listen to him. Give me a drop of that water when your mother's had it, Johnny boy.
Daddy, come here. I want you to go round to Dr. Collins. Ring at the bell and ask Mrs. Collins if Doctor can come round at once because Mummy's hurt her ankle.
Yes, Mummy.
Why, it's one of the Carter boys. What's the matter, dear? Don't cry.
Mummy's hurt her ankle. She fell off the step ladder. We were bringing her the Hollies.
There's Doctor. Robert! Mrs. Carter's in trouble. She's had a fall and hurt her ankle.
I'll go round right away. Come along, John. Dry your eyes.
Tomorrow's Christmas Eve.
I've given her something to help her sleep, Carter. There's a chance that she's broken a bone, so she'll have to go to Silverton for X-ray tomorrow.
I thought you had an X-ray up at the hospital, Doctor.
Yes, nobody to work it except the porter, and that's no use to me. I'll make arrangements with Silverton Infirmary. Where can we talk quietly?
In there, Doctor.
What about your mother and the children? Can you get anyone in to help you? Your wife will be laid up for quite a while, you know.
The boys can go to their aunt for Christmas. Sit down, Doctor. It's no use trying to push Mother off anywhere. Nobody'd have her except us. Thanks, Doctor. I'm off duty tomorrow on Christmas Day, so I can look after Nora, Mother, and myself.
Well, I'll try and get one of the district nurses in, although they're very busy with maternity cases. Can you get any help during the week, do you think?
I'm just trying to think, Doctor. If I can't, I'll have to knock off work. Frankly, I can't afford it. You know how things are, especially at Christmas.
And what about the aunt?
Mary and Mother aren't on speaking terms. It's bad enough to ask her to take the boys for Christmas. But that's all right, Doctor. We'll manage somehow. It's only the paying out that bothers me.
Yes, of course. Strictly speaking, your wife and children aren't covered by the panel.
No, nor is the hospital bill. There'll be an ambulance to pay for, too, won't there?
I'm afraid there'll be more than that. You'll have to get a taxi to run your wife up to Kingham Hospital, and from there the ambulance can take her on to Silverton. You see, you're at the Worcestershire end of the town. The Kingham ambulance won't come over the county boundary, and the nearest Worcestershire ambulance is 20 miles away and won't go over into Kingham.
I never heard anything so damn silly.
It's like that in a lot of places, as a matter of fact. I thought everyone knew about it.
We haven't needed to, Doctor. We've come to you for everything.
Yes. It's bad luck. If your wife had had this accident a few months from now, under the new Health Act, at least you'd have been relieved of all the worry about money. Phone me tonight about 9 o'clock. I'll probably have some news for you.
Right, Doctor.
Stop that pillow fighting and go to sleep at once. You know, I've got those Carter children on my mind, Robert.
Yes, it's ruined their Christmas. What Carter wants most of all just now, quite apart from what I want for his wife,
Is home health.
yes, just that. And I can't get it for him, and no one else can, until the muddle is put straight. You know, I'm expecting quite a lot from the Act, once it's been going for a few years. For one thing, we'll make sure we have more district nurses in the town, instead of making do on 3 women grossly overworked.
And 2 of them have to get around on bicycles.
Exactly. I'm not crazy enough to think that every nurse in Britain will be presented with a motor car the day the Act comes into force. But just the same, there'll be big changes. And Carter would feel pretty sore if he could see into the future, as I can. The future.
Carter, may I come in?
Certainly, nurse. Excuse the dustpan. I'm just clearing up the mess in the sitting room. My mother.
Are the children in bed, Mr. Carter?
Yes, nurse. They've had their supper and gone to bed. I was just wondering what to do for Nora.
I don't need any special attention. I only have my malted milk. Don't I, Tom?
Well, first of all, we'll see to Mrs. Carter and make
her comfortable, shall we? And then we'll plan the menu. Now, Mrs. Carter, how are you feeling?
Better now, nurse, thank you. I don't feel the pain so much. How are the children?
All tucked up and asleep. You're not to worry about anything. I've got a little plan. I'll just get you a nice hot drink, then I'll come back and tell you all about it. She's quite comfortable now, but she might need another tablet about 10 o'clock. We'll make her some cocoa. Now, Mr. Carter, what about your mother?
Mother? I've done her malted milk.
No, I mean, what's she going to say to somebody coming in and running the house while your wife's in bed? I've got a Mrs. Cooper whom I would like to send in tomorrow to look after everything. Yourself, the children, and your mother included.
Yes, I see. She's obstinate, nurse.
Let me try. I'll take the cup while you make your wife's cocoa.
What's happening, nurse? No one pays any attention to me. What's going on? I'm tired and I don't like the music.
I'll say to it, Mrs. Carter. You drink this, and then I'll help you upstairs.
Thank you, nurse. It's very good of you. I'm a crotchety old woman and I get easily upset. How's poor Nora?
She's comfortable now, Mrs. Carter, but she's going to be helpless for a week at least. And I'm worried about you. You need studying.
Yes, I do. I can't help it. I'm old.
I can't have you running up and downstairs dancing attendance on your daughter-in-law. You're not fit for it.
That's all very fine, but someone's got to do the work.
Of course, but it mustn't be you. Now, I've got a Mrs. Cooper. She can come in tomorrow morning at 8 o'clock. She'll make your breakfast, get the children off to school, and do the housework.
Hello? Nurse? You can't call in. I was afraid of that. No, the two children are with an aunt, and Carter may get someone by Boxing Day. The grandmother is a bit of a trial. There's nothing we can do about it. What's that? No, I'm waiting to hear from Silverton. Yes, I know you will if you can. Thanks. If only we'd the proper staff for X-rays up at the hospital, and specialists to read the more difficult ones. Perhaps Kingham Hospital isn't big enough to have specialists on the spot, but we've certainly enough work for a radiologist coming in, say, twice a week from Silverton. Having a health center ought to be a great help. The doctors in the town will be able to work together more closely, and there'll be proper staff to relieve our wives of their jobs as unpaid receptionists, duty nurse, bookkeepers, and heaven knows what.
Doctor, you're ready to X-ray Mrs. Carter's leg now. And you won't forget Mr. Parker's coming over from Silverton this afternoon for the special maternity cases.
Thanks, Matron.
Well, you were right, Collins. There's no need to send her into Silverton Fracture Clinic at all. You've fixed her up perfectly well here.
Yes, but before you started coming, it would have had to be Silverton.
Well, things are much better now, you know. We're paid for our work like you GPs. In the old days, I couldn't have afforded to work in Silverton, let alone come to Kingham. Then I had to make up by private practice what I lost by my voluntary hospital work.
Oh, Collins, I've got the report on Mrs. Brace's blood count back from the lab at Silverton. There's something about it I find rather puzzling. Can you spare me 5 minutes?
Of course. I've someone waiting for me, so I'll come right in afterwards.
Good.
Carter. I've good news for you. It's not nearly as bad as we expected, and your wife will be home tomorrow.
Oh, thank goodness, Doctor.
Sit down. Whenever she feels like it, she can get up. Now that the ankle is strapped up, she'll be able to get about her ordinary duties. Handicapped at first, of course. But the more she uses her muscles, the better. Mrs. Cooper arrived all right?
Yes, Doctor, she's a trump. Except that Nora's up here, you've never noticed a difference.
Good. And your mother?
She's loving it. Never been so quiet in her life. Everything gets done for her by Mrs. Cooper before she can start creating for it. There's only one thing. Are you sure I don't have to pay anything for all this?
Nothing. Except a little towards the home help. You and your family, having put yourselves on my list, get all the general practitioner services free. Every other benefit under the new Health Act is free too, of course, whether you're on a doctor's list or not. You are paying for it indirectly, like everyone else in the country, through insurance and taxation. You'd like to see your wife. I'll get a nurse to take you along. Yes? Yes? Silverton? Dr. Collins Kingham here. You can take Mrs. Carter in tomorrow? No, suspected fracture. Who will be seeing her? You can't get the specialist. Wait, how long? Oh, well, do the best you can, won't you? Yes, we'll try to have her there by 11. Goodbye. County boundaries. We forgot about boundaries during the war, after the first few mistakes. Ambulances went where they were wanted, and that was that.
Robert, we simply must do something about the Christmas presents. I don't know how we're going to disguise the doll's house.
I'll do that, Helen. I think I made a good job of these lights.
Yes, very pretty. The doll's house is over there, dear. I thought you might use that sacking and sew it up.
That's a good idea. It's always more exciting when there's lots to undo. You know, Helen, it isn't only that the money element is being cut out. It's the chance to coordinate the whole medical field. So many of the things I've been imagining we might have here exist already up and down the country. Properly equipped district nursing centers, like that one at Braintree. Medical centers, like the one at Todmorden in Yorkshire and others. Maternity and child welfare clinics, like those in Birmingham. Yes, a really well laid out maternity home, like the one at Luton. Hospitals like the Queen Elizabeth's. The London County Council's laboratories. Of course, there's nothing like enough of these places, and it's going to take a long time to build enough. But we can start right away, making proper use of what already exists, irrespective of local and county boundaries and prejudices which happen to hedge them in at present.
The hospitals will still have their local management boards.
Yes, things which are better dealt with locally, like maternity and child welfare, will still be administered locally. But there will be the chance to group them together with special centers for research and so on, as services available to the whole region. Look at our own region. Hereford, Shropshire, Worcester, Warwick, Stafford, and a bit of Leicester thrown in. We've got cancer centers here, rheumatics here, several fracture clinics. Then there are all the fever hospitals, most of them empty. Half of them could be closed and used for other things. Plastic surgery, we're so well off we can probably help other regions out. This one region has hundreds of different hospitals and clinics dotted all over it. I'm expecting Carter to ring soon after 9. The great thing is that every region will be grouped around a brain, one of the existing university towns with teaching hospital and research centers. Now see what the difference will be. There'll be a properly organized fracture service. The center of it will be Birmingham, but there'll be fracture clinics dotted about over the whole area. Silverton may be one. Radiologists and other visiting specialists will come out to all the smaller hospitals like Kingham. Instead of Mrs. Carter having to be sent to Silverton willy-nilly, she'd only go if it really was necessary to get the best available orthopedic surgeon to put her straight. And she'd get the best man, because he wouldn't have to be wasting his time doing so many ordinary things as he does now. Hello. Carter? How's your wife? No. Don't give it her if she can sleep without it. The taxi must get her to Kingham Hospital by 9 tomorrow morning. Yes, the ambulance will be there. I'm afraid the district nurse can't manage it, but I'll be there around 8:30.
Well, thank you for trying, Doctor. A happy Christmas. Goodbye. Hello. Postman?
Yes. Christmas temporary. Last minute presents for the kiddies.
Any for Stoneleigh?
I think so. Something with an awkward shape.
A crane, that's what it'll be.
That's right. All the way from Australia. And this. You're in luck.
I need it.
Good night. Happy Christmas.
Same to you. Good night.